Good evening, everyone. This is Mayor Shawyn Patterson Howard. Welcome to Sundays with Shawyn. We're asking that if you would please take a moment to start a watch party or share this link. We have a really great show for you tonight. We have joining us tonight Mayor Mike Spano of Yonkers, Mayor Falanka of Portchester, Mayor Roach of White Plains. Mayor Rainey will be coming in a little bit later. And we also have City Manager of New Rochelle, Mr. Charles Strome. So tonight we are coming together as the major cities here in Westchester to talk about COVID-19, the second wave that we are starting to experience here in our region, and talk about, lessons learned and how we'll be dealing with the going forward in our individual communities and collectively in our region. I want to also take out a moment just to say, yesterday we issued an advisory. It was a stay-at-home advisory, keyword advisory. It's kind of like a winter weather storm warning or a wind advisory. It's just advising you that there are things that are changing and we are asking you to take precautions. Unlike what we saw back in March or April, when the governor issued a stay-at-home order, that was an executive order, and an executive order only comes from the governor. This was an advisory letting you know that COVID numbers are increasing, and we really want everyone to take extra precautions and be more intentional and focused about where you go. So we are not closing down stores, we're not closing down restaurants, we're not closing down churches, we're not closing down gyms or anything like that. Those things as of now are open and only the governor has the ability to shut down those things. But we are saying, don't just kind of hang out and don't just go visit friends and hang out at their houses. This is one of the main reasons that we're seeing COVID numbers increase, is kind of the hanging out that people are doing in each other's homes, whether it's friends or family. When we get around friends or family, we tend to let our guard down and we don't focus on the fact that just because they're friends or family doesn't mean that we can't get COVID from them. Even in our own homes, when you're home with your family, everyone in your household does not have to become COVID positive if one person is COVID positive, especially as if we continue to practice social distancing and mask wearing. If you're feeling symptoms, be careful. I definitely had COVID back in the first wave, but gratefully, because the way I conducted myself when I was home with my family, my husband and my daughters did not get COVID because I was very careful, understanding that I was the one that went out every day to go to work and they were working from home. So it is a stay-at-home advisory. We are asking you that, when you don't have to do things, don't necessarily go out, don't hang out. We're seeing far too many people kind of still just gathering in the community without any real focus and any aim. We want you to be careful about going to, different businesses. When you're going into a business, wear a mask. And we want to let the business community know that if you're not enforcing mask mandates when people come into your business, we will not only fine you, but we can shut you down. So that is not something we want to do. We don't get any particular joy in shutting down businesses, but we have to make sure that if we're going to have the fiscal health of our community, that we're taking the public health of our community seriously. So we have our COVID task force. They will be out there making sure that our businesses are operating properly. And if you have a question or concern, you can call 914-665-2626 to report a business that's not complying, or if you see any large gatherings that are happening and they should not be happening. And you can also call 914-665-2500. So we're getting ready to jump right into the heart of our show, and we are going to pull in my incredible partners in doing government work here. So welcome Mayor Mike Spano, welcome City Manager Strome, welcome Mayor Roach, and welcome Mayor Falanka. Thank you all for joining me tonight. How's everyone doing?
Doing well.
Okay.
All right.
So, Mayor Falanka, I'm going to start with you. I'm going to start with you because we know Portchester right now is um, kind of going through a really rough time. We've been declared an orange zone, and we've seen that on the news. And trust me, I know that that is not easy on you to see numbers rising in your community. Can you talk to me about what are some of the steps that you're taking right now and how you're working with the county, the state, and your community to reduce the spread? What's on your heart? Talk to us.
Thank you, Mayor. Yes, we're very concerned about our numbers going up in Portchester. We were designated a yellow zone, and 2 weeks later, very quickly, our numbers kept going up. We were designated an orange zone. We're the first ones in Westchester County to be designated, have that designation. The hard thing is, it comes with some requirements that affect the businesses, which we're most concerned about. Most of our restaurants now cannot have indoor dining. They can have outdoor dining, 4 to a table. That's a big concern. Barbershops, gyms, nail salons, and those businesses are closed. So we're very concerned. So the people are, calling me constantly, especially the business owners, and saying that this second wave could really hurt their business. We lost several restaurants in the first wave, and my main concern now is that we don't get elevated to red, which is a complete shutdown. We're taking measures. We've worked, like you mentioned, with the state and county government. We've been very thankful to Assemblyman Steve Otis and our state senator Shelley Mayer, and of course our county legislator Nancy Barr, and the main person, our county executive George Latimer. They've been very helpful to us. We're getting more masks, more hand sanitizers. We got some message boards now that we're placing in strategic locations around the village, asking the people to wear masks, practice the social distancing, and they're mobile, so we'll be moving them into different neighborhoods. We've had a lot of problems with social gatherings. As the numbers went down 5 weeks ago, we got down to 10 active cases. And in 5 weeks, we're up to 190, and that's as of Friday. And I believe we're more than that as we speak. So, the concern is here in Portchester. The police department has gone to all the businesses with flyers. And we're watching the social gathering, especially in our parks. They end up in our parks, and they play soccer. Everybody was cooped up for a long time, and when the weather got better, they came out, and they were still out. And I think that's a cause of the spread in the village of Portchester. So again, we're very concerned, and we're doing everything possible to. I did a robocall. I did a Nixle call. I did a video that goes on our government channel along with one of our trustees who's Hispanic. We did it in English and our trustee did the Hispanic version of the call. So we're doing everything to reach out and warn the community that this is serious, very serious. And if our numbers keep going up, we'll be in that red zone very quickly. And that's a big concern of our officials here in Portchester.
Thank you so much. I mean, please know we are praying for you as your partners in government. I know, I'm here if there's any way that we can assist and share some of what we've done. Every community is going up. I think based on who's on this Zoom right now, Yonkers, the last numbers we got for Yonkers was 389, but you have over 200,000 residents, so we understand that. Mount Vernon, our numbers 124, New Rochelle's numbers 257, White Plains 129, Portchester 190, and Peekskill 108. So we're seeing it, and we're even seeing other communities higher up in the county that have more active cases now than they ever had during the first wave. So it's definitely something that we need to look at. Mayor Spano, I want to start you out with this question. What lessons from COVID's first round the first round of COVID. Some people talk about a third wave, but the second wave was in other parts of the country. This is our second wave in this area. What lessons from COVID-19's first wave did you learn that you're applying to kind of what we're seeing now and how to move forward in Yonkers?
Oh, we're actually watching exactly what transpired the first time, which is the areas in the city of Yonkers, the zip codes 10705, 1070, 10703. These areas that are primarily communities of color, they are our most densely populated communities. As you know, there's a tremendous number of people that live in these communities, and that's where we're seeing the rise. That's where the rise is taking place. And, when I look at those numbers, it's scary. Now, I monitor the hospitals, Mayor Shawyn. I monitor the hospitals. The hospitals are not seeing the same type of, situation that we saw last year as of yet. That's good news, and I hope it stays that way. So while we're watching the infection rate go up, I'm not seeing the what we saw, which was not that all that long ago, where our hospitals were completely at max. We were losing many residents a day, and it was almost a it could have been a case of pure panic, but it wasn't, because of the professionals, whether it be those in the healthcare industry or our first responders. Everyone did a great job, and I think everybody's prepared for what may come next. But we have to do our part, and I think what you did, your advisory, was the right thing to do. I know it came across as something more than an advisory, but it's true. We have to do things like wear our masks, practice social distancing, limit the amount of people that we're exposing ourselves to. Listen, this is going to be the first year that I won't be sitting with 90 of my relatives for Thanksgiving dinner. I mean, think about that. When the governor says you can't have more than 10 people in your home, and I have 15 brothers and sisters, we laugh about it, but it's really very serious, because we're keeping my mom as isolated as we possibly can from all of us, and so but this is the only way we can get through this. We get through this when we make the hard decisions. We are willing not to glad hand and be close to our relatives and our friends at this time. Because if we do it now, we can get past this COVID-19 and onto a regular life. But unless we do the things that we need to do and we ought to be doing, and what has been suggested that we should do, it's only going to make matters worse if we're not paying attention to those details. And I think the lessons are, I feel that people are listening, at least in the communities I'm talking about. There are people, they are listening, but like I said, the infection rate is something that we have to watch. And it's a scary number. Again, I don't see the people being as sick, and I don't know what that means. Because I'm not a doctor and I'm not an expert, I just know what's happening here. But I know across the country, hospitals are at capacity. That's not happening here, not just yet.
Thank you so much. So Mayor Roach, in White Plains, what information are you tracking? What type of information are you tracking that helps you make decisions around governing? And what lessons did you learn from the first round of COVID that you are applying to your wisdom now and your approach?
Well, thank you. I think I actually look back to Sandy, because Superstorm Sandy was such a devastating situation that we started doing daily robocalls and found them to be well appreciated and very helpful. So when COVID started, that's what we did. We went on, we started to do, I said, let's do a robocall. I think we did one, and then got very positive response. And I said, I think we're gonna have to do this every day. And I believe I think someone told me we did 100 days in a row, a robocall every day. And so we're doing one a week. We've never stopped. We still do one a week, and that is our opportunity to kind of get the information out to people. And I think that's vital. People need to know what's happening as best. Everything we know, they should know, and I think we all believe that. And we put it out there, and we try and put it out in a way that also points out hope. And so I think we benefit from that. And what I look at is what all of you look at. We get every day the county map, which estimates the active cases, and we get the share file where we can see who's tested positive in our community and who's new to test positive. And I think I know my city well enough to look at that and the addresses and have a sense of where we're seeing activity. And we just keep on pushing out the message. I think it's really important for people to realize that a lot of people are talking about COVID fatigue, and it has been going on. If you think about it now, it's since March. So we're like, oh, how many? We're 8 months into this thing, and we're still going. And I try and keep people focused on look where we are now. Look at the summer we were able to have, not 100%, but it was adaptive, an adaptive. Way to deal with it. We adapted our behavior. People wore masks, and we saw positive things happening. We're concerned people are getting a little tired of it now. We want to just remind them now we just got this great vaccine news. We know this will end. We know this will end with the virus being defeated. So knowing that, we're hoping people can just keep it up so that we all get there. To comment on something that Mayor Spano mentioned, I think because when we all went through this the first time, testing was hard to get. You had to demonstrate that you had symptoms, and they were pretty serious about what they considered to be symptoms. And now anybody can get tested. So more people are being tested, and I think they're probably finding positives that wouldn't have been found in March, especially with younger people that are just not feeling sick. So there, we have that out there as well. But I also, we have found really, really strong compliance with our mask requirements. And when you talk to mayors, at least maybe not recently, but before upstate or in other states, I think they were dealing more with the people who were saying that this is my freedom. You can't make me wear a mask. I think our area knows what a monster this virus is, and just how devastating this is, and how many good people we've lost to it. And so I think we have I haven't had to work hard to convince people to put on their masks. And I don't know what all of your experience has been, but there's a few people, but I've gotten like 2 emails telling me I'm taking away their freedom. But other than that, I've gotten a lot of more emails telling me when I go down Mamaroneck Avenue, I saw somebody without a mask, or things like that. So hopefully, it's. I think the president-elect said we're headed for a dark winter, and I think it's true. But we can all act to mitigate the impact that it's going to have.
Thank you so much. So I'm just going to take a station break because I did make some comments in the beginning, but people are just jumping on. So I want to clarify again. I issued a stay-at-home advisory, Mount Vernon. It's an advisory. We are not shutting down Mount Vernon. Schools will be open tomorrow for pre-K through 3. You can go to work. You can go to church. Stores, restaurants are still open. We are saying and advising that if you don't have real business to do, then relax, stay at home. We are asking that you reduce your gatherings at your home and with friends, and that you're not just hanging out. Don't have even friends and family spending over and doing sleepovers with the kids. That really, when you're home, just focus on your home. And when you have to go out with a purpose. We're asking people to even kind of reduce just the hanging out in the neighborhood, the hanging out in the parks. But if you're going to the supermarket, if you're going to work, if you're going to church, if you're going to school, if you're going to the gym, I'll be in the gym at 7 o'clock in the morning. Trust me, because that's what I need for my mental and emotional health. But I'm there with a mask. I'm sanitizing my machine. That's what we're doing. So there is a difference between an advisory and a stay-at-home order. Governor Cuomo has not issued a stay-at-home order. He is not shutting stores and restaurants and hair salons. None of that is happening right now. Mount Vernon is not a yellow zone. We're not an orange zone, and we're not a red zone. So we can still go places. But we're asking people to exercise common sense. We are asking people to really deal with your COVID fatigue, wear your mask, continue to sanitize, and social distance. We're not creating a police state, but we also want to make sure that we're taking the necessary precautions that we need to take as a city so that we don't get to a space where the governor or anyone else has to shut down our businesses. We've lost businesses from the first round of COVID. We do not want to continue to lose businesses. When we lose businesses, that causes jobs, it causes services not to be provided, it causes a decrease in our taxes here and our tax collection here in the city, which will cause a decrease in city services being offered. So we're asking you to really exercise precautions and take COVID seriously, as we are seeing an uptick. And we're in the winter season where we're going to see pneumonia, where we're going to see the flu. And we saw during the first round of COVID that a lot of people were dying really because of breathing issues, and that's what was causing challenges. So we don't want people to have COVID, pneumonia, the flu, and all of those things at the same time. So please exercise common sense, exercise caution, and take this seriously. By all means, schools are open. Send your kids to school, send them with a mask, send them with a shield, send them with sanitizers. Do that. So Mayor Strome, City Manager Strome. I'm calling everyone Mayor. Nome isn't able to make it, so thank you so much for joining us. New Rochelle was the initial epicenter in our area for COVID. It was the first community that got hit, and not only was it hit hard, but schools are open and kids are back in school. How are things going in New Rochelle right now, and what is New Rochelle doing in the schools as well as in the community to continue to manage COVID?
Oh, thank you for having me. We're very happy not to be the epicenter this go around, and we're doing a lot of the same things that the other folks have mentioned. We have a two-pronged responsibility here. One is to our community, and I particularly, as a city manager, am very inclined to make sure the city workforce is protected. We were caught, like everybody else, with no knowledge the last time it happened. And what we saw was an event, I guess you'd call it a super spreader event, a couple of bar mitzvahs and a wedding that one infected person went to. And it really was the first time a synagogue community, which was basically shut down for a couple of months. But as it's gone on, like everywhere else, it's the dense areas of the city, the zip codes where we have apartment buildings, public housing, and things like that, where the infection rates are going up. We also had a college problem. Iona had a cluster, I guess, of 85 staff and students who had COVID. But our big responsibility, I believe, is twofold, and that's getting information out to our residents and trying to, not be so harsh about it, but trying to get compliance with the directives that the health officials have given. As all of us know, we're not public health experts, so we're very much reliant on the county and the state health departments to tell us what measures should be taken. We have a position in our government called a business ambassador who goes out to all businesses to make sure they have a plan and checks with them on a regular basis and responds to complaints from people who go to a business and see no masks or things of that nature. We also get the same complaints that you all get. Somebody's walking down North Avenue without a mask, go do something about it. It's very hard to do. So I think really it's communication. The robocalls are a very effective measure that we've used, like everybody else, and the website that we have and our public access channels. We use all of those modes of communication to tell people that this is what they need to do to take it seriously. And again, we between waves, I guess you would say, we really made an effort to stock up on the stuff that we need, the sanitizer, the masks, and all these stuff that we can give out to people who may not be able to get them, and particularly make sure our first responders are protected. You know, we lost a fire captain, healthy young man who got in his 50s, and he got COVID and didn't make it. So we were particularly hit hard in that regard. And the one thing I do want to say about the hospitals is we're seeing the same thing here. And, you know, you mentioned those numbers, 250 for New Rochelle, and we're 80,000 people. I think we all realize that those numbers are probably 50% of what we really have. The hospitalizations are not as high, that's correct, but the people that go to the emergency room and seek treatment, the positivity rates are rising rather considerably. People are being recognized as having COVID. So we can only hope that those hospitalizations and ICU situations don't repeat themselves. And our real role, like everyone else, is to keep people informed and encourage people to follow the public health experts and what they say to do. And I think it's happening. There will be cases where people do not want to, but as Mayor Roach said, the great majority of the calls we get are people complaining to us that other folks are not complying, not calling up to saying, what are you making me wear a mask for? So I think we learned a lot, and I hope it shows in this go round that we'll be able to manage it a lot better from the municipal point of view. As you know, we all follow the lead of the governor's office and the county executive, and the county government with the county health department has been very helpful throughout this. So we'll keep doing it and hope for the best.
Second part of your question was, how are things going with your schools being open? I know New Rochelle, Yonkers, White Plains, the schools are open. I believe Peekskill, the schools are open. Mount Vernon's schools are scheduled to open tomorrow. So how are things? How are you managing and working with the superintendent to manage COVID in schools?
Mayor,
I was just going to say, our schools have been open. They did the elementary schools first. They then went to, we have 5 or 6 elementary schools, 2 middle schools, and a high school. And last week they started with the middle schools. And I'm not real sure how they're going to do a high school of 3,300 students, which is what we have in the New Rochelle High School. But I get most of my information actually from we have an acting superintendent, but my daughter's a teacher in our school system. And so they've been struggling, you know, some students their parents don't want to send their kids to school. It's very hard. You know, we talk about first responders. This whole thing has been very difficult on teachers. We're working with our school district in New Rochelle, and I think in everywhere except Yonkers on this call. It's a separate entity. They're their own taxing entity, but we're working with them to try to help communicate and provide them with whatever they want. We've been trying to get money from our developers to give to the school district, and we've used some CARES Act money to give to the school district to create hotspots and help them get Chromebooks so that all the students can have access, because although the schools are open, as you know, they're you know, a lot of it's still remote learning. So not everybody's in school every day at the same time. So there's still a lot of virtual learning going on. So we're trying very hard to work with our school district to make sure that all students, even those that may not be able to afford this stuff or live in an area where there's Wi-Fi, can get the hotspot and the Chromebook so that they can learn. It's a real problem if they fall behind because of this, then they don't have the equipment. So that's been our experience. I'm not sure how much longer it's going to last. There have been cases, but we're monitoring it, and hopefully they'll be able to let the kids stay in school, at least in some form, up until the holiday break.
Thank you so much. Thank you. So I want to go back to Mayor Falanka.
Port Chester, when we were designated a yellow zone, the schools went remote. They will continue to operate remote until further notice. We've had some cases in the elementary and middle school. and some custodial staff also was affected. So this school board and the superintendent made the decision to go completely remote, and that's where we are now as far as schools go. I just want to say, we continue to educate our residents here in Portchester, but the big thing is, our residents and all residents, wherever they're from, have to take personal responsibility to keep themselves, their family, and their friends safe. They got to realize how, and this is what the message that we're trying to drive home, that, we need their help to keep the community safe. They need to take that personal responsibility, wear that mask, do the social distancing, no social gathering. With regard to the orange zone that we are presently in, there's 10 people maximum, indoor and outdoor. Churches, 33% capacity, 25 people maximum in churches. The high risk businesses being closed, it's taken a hit on Portchester community. And, they're struggling as it is, even after getting through the past wave, the first wave, we call it. They were struggling to get back. And some of them were just starting to see the light, and they're back going backwards again. So it's hard. And as I said earlier, we lost several businesses, some nice restaurants, and I'm very fearful that if this continues here in Portchester, I'm just saying, if our numbers keep going up like they have been, we're looking at a red zone. We did a lot of testing. That's our open door clinic and one of the centers here. We're testing all last week, and we haven't gotten the results of the latter part of the week's testing. So I'm assuming the numbers will go up, and we'll see what that does to our designation next week when we hear from the county and state.
Okay, thank you so much. So, one of the major issues we've dealt with is not only the physical health of our community, but the mental and emotional wellness of our community, with so many people losing jobs, with people being concerned about evictions, foreclosures, businesses are worrying about closing down. People are trying to gain access to capital. Others are trying to figure out, what is my career going to look like if COVID lasts much longer? Am I going to have to develop new skills? People are tired of staying at home. Depression has increased. We know that alcoholism has increased. We know that domestic violence has increased in our area. How are we addressing those issues? How are you addressing those issues in your community? Mayor Spano?
And I want to answer that, but I'd like to though just touch on something that we haven't touched on yet, and because I think it's going to be very important for us to talk about this, because it's something we're all going to go through. Yonkers. We talk about the size of Yonkers, so we have multiple zip codes in our city, and some of our zip codes are hit heavier than others, and I could see very, very, very soon one of our zip codes going into yellow, right? And remember, Yonkers has a school district that is we have busing, so our kids are from all over the city, and you're going to have a situation where you're going to have parts of your community in different zones. And so, our people have to really pay attention as to what's going on in their community, because their restaurants may be closed. But then a few blocks away, they may not be closed. The schools might be closed in this particular neighborhood in Yonkers, but not in other parts. And so because of the infection rate, because there's such disparity between zip codes. And so, and I would imagine that is something that we're going to see, obviously, across the county. But it's something that we do have to pay attention to, and it's something that, well, at least our office, I want the people, residents of Yonkers, to know that we are going to heighten awareness to that, so that people understand, how COVID is affecting them and their immediate community here in the city of Yonkers. So we're not going to be able to say, Yonkers this. We're going to have to probably say something like, well, 10705, we're in a yellow zone today.
It's our tornado warning. There is a tornado warning for our area until 9 p.m. So everyone, there is a tornado warning. You might be losing different people. We've already gotten notice that about 125 of our households up near Hutchinson Boulevard has lost power. So there is an extreme tornado warning in the area until 9 p.m. and they're telling people to take cover. So please, if you know people who are outside, tell them get inside. And if you're in a trailer or anything like that, please be careful. So take cover, come inside. Yeah, this isn't an advisory. It's an alert. It's a warning that there is a tornado coming through our region right now. And as you can see, everyone's phones just went off.
Yeah.
Yes, what's saying?
Yes,
I was just reading that. It was saying that we should seek shelter in the basement. So, as you can see behind me, I got a lot of glass. So, and this has had an effect. All of this and all this uncertainty, I mean, has had an effect, obviously, on people. But I think that the best thing that we can do, and I kind of went off to something else. We might have to help you with the question again.
So, really, what are we doing to address the mental and emotional wellness of people in our community? People have the COVID fatigue. They're tired of staying home. They're overwhelmed because, unemployment. What am I going to do with the future of my career? With so many things going virtual, restaurants, stores closing down, evictions looming for so many people. We know that there's emergency financial assistance, but it's just not enough to meet the need for everyone. How are we dealing with it? And then we have a lot of people who are sheltering in place with people who they may not have the best healthy relationships with, where there might be domestic violence or abuse, and yet we're isolated and having to stay at home with them. How are we dealing with and providing support around mental health?
That's right. And the other thing too, don't forget, is that unemployment, for instance, in the city of Yonkers, at one point at the height of this was at 20%. It's gone down in 5% increments, down to 10%. That still means that every, if you see 10 people walking around the city of Yonkers, at least one of them is unemployed. Probably the person who can least be unemployed because of, maybe someone that has a limited income in a struggling family, a struggling situation. So, how do we, that's a really good question. How do we really, I think the best way for us as mayors to deal with the whole mental after effects of COVID is to just, be very, very reassuring, be very open and communicate often with the residents. I think that, I think that's what we're all doing. We're out there. We're communicating. We're getting support to communities that need it. We spent about $2 million from our IDA just to giving small grants to small businesses so that they can keep some of their restaurants open just for a little bit longer, maybe enough. These are the things we're doing, but I think that there will be some long-term we'll have to deal with at some point.
It's on the phone.
So there'll be some long-term effects that we'll have to deal with. I think be reassuring and helping people get through the mess.
Thank you so much. So what are some of the biggest COVID quality of life issues that you're dealing with right now in White Plains, Mayor Roach?
Well, I think you've got, you were mentioning the schools earlier. I have a senior at the high school, and they have a hybrid system where they broke up into 4 teams, and each team is physically present in school 1 day a week. But they miss their friends. And, the one day that you get, you're assigned to a team and this is your day to go, maybe, you see a couple of your friends, but not everybody. And so I think that's kind of wearing on them. I think that's what I've seen there. I think people just want to be out with other people again. A lot of the things that we took for granted, people feel affectionate towards someone. They want to give them a hug. You want to shake hands. None of that is happening, and I think it starts to impact on the way people feel about things. What I think what I think we need to do is focus on making things as good as we can make them, and so we're trying to remind people, hey, we got good news on the vaccine. Let's keep it together. There is going to be an end to this, and just stay focused on the positive.
Definitely. Thank you. Thank you so much. So, you're talking about the vaccine, and that's been one of. So, hold on. Let's go for a commercial break. If you have lost power in any of your communities right now due to this tornado and this major rain event that we're having, you can call 1-800-752-6633. That's ComEd. This is in any of the communities. 1-800-752-6633. I thank goodness for my little backstage team that keeps putting messages in the chat. Mayor Spano had to pull out because he said it's getting really, really bad where he is. And so he needed to pull out of this conversation. So we're praying for him and his family. We're praying for everyone around the county right now. Hopefully in about 15 minutes, this will pass and we will be through this weather event. So one of the things that I also want to talk about is here in Mount Vernon, when we talked about quality of life issues, one of the biggest challenges that many people had outside of health and economics during COVID is parking. Parking and not having enough parking, and with stay-at-home mandates months ago and stay-at-home advisories or people just working from home, that parking is difficult. Here in Mount Vernon, we suspended alternate side of the parking earlier in the year, but we reinstituted it. And right now we still have alternate side of the street parking. So a lot of the quality of life concerns was when you suspended alternate side of the street parking, it was very hard to do garbage collection or street sweeping and things of that nature. Here, Mayor Rainey is coming in and things of that nature. So that's one of the things that we're going to have to balance going forward, especially with the fall and leaves coming down now and winter coming up, to suspend alternate side of the street parking and not being able to clear away snow, leaves, garbage. It's going to be difficult. So parking is going to continue to be an issue. I know that's something that we had lots of people complain about was that. And then also, really just crime has taken an uptick all across the country, and even in our region, people are reporting more car break-ins and things of that nature because of the number of people who are unemployed and because of the number of people who are feeling a lot of stress and dealing with a lot of challenges. So these are things that we have to continue to take a look at in our community. So Mayor Rainey, I know I can't see you, but you're there. I want to pull you into the discussion right now. I don't know if you're able to enable your camera where you are. I know
Yes,
you're
I can hear
traveling
you.
a
I
little
can
bit
hear you.
right now, but you could hear me. Thank you for joining us and coming in.
Absolutely.
What are some of the lessons that you learned from the first round of COVID, and how is that helping to inform what decisions you're making in Peekskill as we're looking at a second round of COVID impacting our region?
Yeah, I think one of the first things we noticed was once we started closing things down, that's when the numbers really started slowing down for us. It's a tough situation to ask the community to try to prevent themselves from going out and being places with their family and friends. But that was the most successful suggestion that we actually made during this entire year with the process. And closing down certain parks and doing the takeout only for the restaurants, like that really lowered it. And I think that one of the things that we have to do is remind people that, the reopen didn't mean that the virus went away. The reopen was to try to help the economy stabilize itself. And, people, I feel like a lot of people took the reopening as an opportunity to get back to normal life. And, part of the situation with, the mask wearing, a lot of people are promoting and asking to wear masks. And now that we reopen, you see people not wearing their masks. They're not wearing their masks everywhere, and they're taking that risk and they're taking that chance. And more importantly, not a lot of people are carrying sanitizer and cleaning certain areas. You have people wearing masks, but they're getting on the trains and they're getting off the train. They're touching the doors at the restaurant when they go get a cup of coffee or whatnot, and that just helped the virus travel even more. So one of the things that we really realized was, the shutdown, as unfortunate as it is, was probably the best decision that this city has made, against a lot of people's will. And again, it's hard for the economy, so we try to come up with creative ways with the free parking in the city of Peekskill, to help patronize the restaurant and local businesses. So, and another thing I will say, and I ended up this, I don't want to take too much time, but another thing that we also realized too was, the signage of, wearing masks and sanitizing. I think that was almost like a free campaign for the city of Peekskill, putting signs up at the park, and the police were posting it on their social media page, the city of Peekskill posting on their social media page, and all of the activists in the community that really have solutions and ideas, they also help promote wearing masks and sanitizing your hands and keeping yourself clean. So that signage and the message of doing it, I think that helped us out a lot. But again, people got back to their normal lives before COVID has actually disappeared.
And that's such a critical point. I definitely agree with you. As the warm weather came and people took off their coats, they also took off their masks. Thankfully enough, we had already kind of went through our peak, and we were dealing with low numbers and therefore low infection. But as infection rates go back up, we really need people to remember to put on their masks. I need people to just take out a moment. I watched, what was that, Grey's Anatomy the other night. I watched Grey's Anatomy on Thursday night, and it was very interesting because it was, in the TV show, they were at the height of COVID. And for a minute, it just really, really took me back to where we were in March and April. And I need people, we're not trying to terrify people. We're just trying to say, let's use the lessons that we learned back in March and April and May to really kind of head off and flatten this curve that we're dealing with now. Remember, there were people who said Facebook became death book because they were looking at so many RIPs. They were saying that, they hated not being able to go to the store, not being able to see friends and family at all, not being able to really leave the house except to go to the supermarket and for essential errands. And we can't forget that time. We can't forget that time, because if we do not take precautions, if we don't take this seriously, and if we don't take incremental precautions, we could find ourselves back at that place. And I don't think that's going to be good for our economy. I don't think it is going to be good for the mental health and the emotional wellness of our residents. But we could find ourselves there if we don't do what is necessary now to really flatten this curve before it goes high. Mayor Rainey, Mayor Roach, you and I have been doing some things with Harvard Bloomberg, and everyone is talking right now about vaccines. And so this is going to also go to Mayor Falanka as well as City Manager Strome. People are talking about the vaccines, and we know that the vaccine has been hailed much and is scheduled to come out in the next few months or maybe a little bit sooner. And at the same time, we have a lot of people greatly anticipating the arrival of the vaccine. We also have large segments of our communities saying that they're not interested in taking a vaccine because they don't trust the vaccine. We still have people who don't trust flu shots. So as we're waiting for a vaccine, and we hope that that's coming, what are we going to do to really reach people who are not trusting of a vaccine? How do we really reach out to them? And it's not just the minority community; it's also the Hasidic community. They're in the Orthodox Jewish community. They're not really in favor of vaccines or anything like that either. How do we reach those communities? How do we engage them? How do we get them to think favorably upon this? And how do we deal with people who say, well, I'll wait 6 months into the vaccine to see how it goes for other people before I even consider it?
Well, in terms of, I mean, I think what we're working on is putting together a committee that would include, and not a huge committee. I'm trying to keep my committees as small as relatively small so they can get things done, but with medical people, but also key stakeholders in the community, figures that are trusted within the different communities in our city, that can get the information out to people. I think when people hear that information from someone that they trust, then they're more likely to accept it. The way, as Mayor, as you mentioned, we were just on the call with Bloomberg, Johns Hopkins, and the Kennedy School, and they talked about there's 4 vaccines that are getting to the point, getting near the ends of their trials, and that the first one that's been discussed, looks very promising, the Pfizer vaccine, but that the other 3 were following a similar path in terms of what vulnerable aspect of the virus they were going to attack. So everyone's confident, and then what we heard was that in the epidemiology community and the people that study this stuff, getting that 90% effectiveness was shocking. They were hoping for 50%. So I think that's a real positive. But I agree with you. We need to make sure that the vulnerable portions of the community, the places where the spread is greatest and where people are most at risk, we need to make sure they get access to this vaccine, and we need to make sure that we get the information out to them in a way that that people comfortable with. I feel optimistic about it. I think there is, this is not going to be the day that the first vaccine comes out. Not everyone's going to be able to get one, and that's unfortunate. But I think knowing that it's there, we're hoping gives people more positive outlook on what they still have to do. We still have to wear the mask, social distance, and follow all the other protocols that we've discussed over and over.
So we have about 5 minutes to go, and I'm going to give you an opportunity, each of you, to give closing remarks, closing statements. But one of the things that I just really want to touch on is before COVID, there were a lot of disparities in each of our communities around health, around education, around employment, around housing. But COVID-19 is something that has elevated these discussions even more. We know that the school to prison pipeline is real. We know that a lot of our vulnerable residents and our Black and brown and our poor residents, that their academic outcomes are not as strong as other segments of our community. And we know that them working and learning virtually hasn't improved any of that. So hopefully, if and when our communities kind of reach a better level of stability, we will continue to really address the disparities and make plans, real strategic plans and intentional and impactful plans around how we are going to address the inequities around health, around education, around housing, around employment training, and all of those issues, because we cannot leave this epidemic without really focusing on some of those things. Those are going to be key. And so with that, I want to start with Mayor Falanka, then City Manager Strome, and then Mayor Roach, as you give your closing comments. And if you could limit them to about a minute and a half.
Will do. Thank you, Mayor. First of all, I want to thank you for organizing this evening. It was a great forum, very informative, hearing what other communities are doing. Again, my closing comment would just be to the residents of Portchester and the residents of all your cities: take COVID-19 very seriously. Continue to practice all of the CDC guidelines of social distancing. Stay away from mass gatherings. Wear your mask. Use your hand sanitizer. That's how you're going to keep safe and get these numbers down. We're all going to feel the effect of this for a while, but if you practice all these CDC guidelines, hopefully we control it here in Westchester County. Thank you for this evening, Mayor.
Thank you.
Okay, Mayor, I want to thank you also for having this forum, for letting us come on. And I would just like to reiterate what Fritz just said, but also tell people that their actions not only affect themselves and their loved ones, but they affect everybody else. And, you know, as, in a city manager form of government, I'm responsible for the people that work for the city. And I want to make sure people realize that the healthcare workers and the policemen and the firemen and the ambulance folks they were in the front line last time. They'll be in the front line again this time. And I would hope everybody shows some respect for them and takes the appropriate action, because our actions don't just impact how we do and what our health is. We interact with a lot of other people, and we should really take those folks seriously and do what's being recommended by the public health experts so that everybody gets through it, but particularly those that and I want to thank the folks in New Rochelle that are on the front lines, and everywhere. I'm sure everybody feels the same way. We really have to protect those folks as well as we can, because they go right into the fire, and it's a tough thing to do. So I would hope people would keep that in mind and act accordingly, so that they're not only taking care of themselves and their families, but the people that they interact with in their communities.
Thank you so much. Thank you. Mayor Roach?
Well, I want to thank you, Mayor, for setting this up as well. I don't think many people recognize how much we all communicate with each other. And we represent different communities in many ways, but similar in others. We all represent communities where there are people that are face economic challenges. And one thing we know, whatever the disaster, whatever the issue, those people facing economic challenges will feel it more severely, whether it's climate change, a pandemic, an economic a recession or depression. And so, you know, we do have to focus on that. We did our own food distribution because we had that concern, people that weren't going to be able to work, and also were not eligible for any type of aid. So we did step in right there, but there's a lot of work to be done. And so I would join with everyone, just urge people at home to take this very seriously. And, you know, I read today a nurse in one of the Western states that's being hit very hard right now, talking about how frustrating it was for her to work her 10th double shift and be driving home and see people line up to go into a bar. And so let's do it not just for ourselves and our families, but for our greater community and for those people that are putting their lives on the line.
Thank you. Thank you so much. So, you know, look, everyone, here we are. We've talked about it. Numbers are going up in our area, but we are strongly cautioning people to take this seriously, to continue all of the CDC guidelines, wear your mask, social distance, carry your sanitizer with you. Don't go into mass gatherings, whether it's in your home or in friends' homes. Take extra precautions during the holidays. Look, we dealt with Easter, Rosh Hashanah, so many different holidays during the last shutdown period. And so we are not looking to go into a shutdown, but we are asking people to use precautions. There are, you know, Portchester right now went through a yellow zone. They're in an orange zone. All of us really want them to get back to not being in a zone at all. Each of our communities want to stay out of those categories. And this will only happen if people take personal responsibility for themselves, focus on taking care of themselves and their families, and following precautions. We ask everyone to continue to stay safe. Mount Vernon schools will be opening tomorrow, pre-K through 3. The mayor does not make that decision. That decision is made by the superintendent and the Board of Education, and we will continue to communicate closely with our superintendent and our board and make the best decisions for our young people going forward. Thank you again, gentlemen. I appreciate you, and I'll be speaking to you soon, and let's continue to connect so that we can work together around COVID and other issues affecting our residents and strengthen our communities. God bless everyone and have a great night. Be safe. Take care.
Thank you. Good night, everybody.
Thank you.